Got some CBD here. This is CBD hemp by TKO. Thanks for joining in, guys. I got some CBD, some hemp right here. Just gonna light it up real fast. CBD is less than 0.3 THC, so this is non-psychoactive. And can y'all hear me? Good. Old school matchbox. Every day I got a grill. Use a grill lighter. All right. Again, that was CBD hemp by Terp Nation. I'm a fan of full spectrum. Y'all know that. All right, so we're talking about how cannabis can help with some of this chronic pain, and when chronic pain causes depression. So let's recap. Every antidepressant that I have prescribed, that y'all have taken, it takes about 6 to 8 months for it to kick in. So there's a problem, one. By the time you see a physician and you're dealing with depression, PTSD, or anxiety, those antidepressants are going to take at least 6 to 8 months to start working. CBD, cannabis, puts dopamine right in your brain. Every antidepressant that was prescribed to you, the main purpose of it is to put dopamine in your brain. So cannabis does it easily, okay? And there's over 100 different strands, and you can find and tailor to what helps you and works best for you. So let's talk about chronic pain now, okay? So y'all all know I broke my neck in 2012. And I'm gonna be totally transparent so this can help you. I was working out every day, father, I was a husband, a normal person, went to work. A lot of this stuff, as far as our ego, what men are built on is what we can do with our hands and what we can do with our might. So in 2012, I went from working out everything to a broken neck in a chair for 3 or 4 months, right? And left me with chronic pain. And for those that have chronic pain out there that are listening, it affects a third of America. So a third of America is dealing with chronic pain. And this is not like you come in with a lung infection or, you say, hey man, my sinuses are hurting me, doc, and I write you a Z-Pack. And I can tell you without a shadow of a doubt that you're gonna feel better within 4 to 5 days. Chronic pain, this is my life all day, all night. There is no feel better for me. But there's millions of people like out there in America, in the world, that are dealing with chronic pain. And when you have chronic intractable pain, 99% of us, depression is coupled with it. Major depression. And if you think major depression is like some crazy disease, how many people have problems with sleep? Most people, right? Then I ask you another question. How has your interest in things been? Your normal activities, your daily hobbies. Like, if someone used to sew all the time, they just stopped sewing. If I used to paint all the time, I just stopped painting. If I enjoyed morning walks and looking at art and I just didn't have the energy, I just kind of been unenthused about taking morning walks, that's another sign of depression. Also, concentration. When you're depressed, the concentration is terrible. It also affects your appetite. And then it also can cause psychomotor agitation. You see people that are constantly fidgeting their hands, writhing. That's called psychomotor agitation. And then lastly, there's suicidal thoughts and suicidal ideation. So if you're 6 or if you raise your hand for 6 of those symptoms, sleep, interest, guilty feelings, concentration, appetite is poor, or you're just binge eating, you have psychomotor agitation, 6 of those, that makes you positive for major depression. Absolutely. So you're just walking around undiagnosed. And if you're waiting for those antidepressants to kick in, you got to wait 8 months. And if you're saying, yeah, 8 months is going to work for me, antidepressants work 2 out of 10 people that take it. It's going to work. You might fail it. You got to wait another 6 months. He's going to prescribe you another Zoloft. He's going to prescribe you this. He's going to prescribe you that. And by then, your trust in the healthcare system is totally like, because I've been there. When I broke my neck, I went to the surgeon, and the surgeon said, hey man, I'm sweating, it's hot as hell. He said, hey, we're gonna put these plates and screws in your neck, right? That was the only option. So I get plates and screws in my neck in 2012, and I'm thinking I'm gonna be fine. No. A year after my plates and screws, my spinal cord, I started developing bone spurs on top of my spinal cord, right? So now I'm dealing with intractable pain again. But this surgeon, I laid on his table and he was supposed to fix me. Now, if anyone's been in that situation, cancer, they took the chemo, it didn't work. Hey, oncologist, you said this was gonna work. You know, anyone dealing with autoimmune disease, you know, sickle cell disease, chronic pain, hey, I did this hydroxyurea, I'm taking my water, I'm exercising, and yeah, I'm still suffering. And for most of us with chronic pain, we look pretty dope on the outside. Like, you wouldn't tell. You'd be like, Doc, what are your problems? Now, if you look at this scowl. You see that scowl? Yeah, that's a wrinkle of someone dealing with chronic pain, because it confuses you. It attacks at you all day, all night. So, yeah, I suffer from chronic pain, and yes, I suffer from depression as well. I also had anxiety. You know, when you have chronic pain, your level, you know, that stupid pain scale for all my patients and caregivers, there's a stupid pain scale 1 to 10. Most people with chronic pain, they're walking around at about 1,000, just suffering. And then we try to lead this normal life, but you're also worried about, what if my pain increases from 1,000 to 5,000 while I'm at work, while I'm driving, while I'm at this movie, while I'm trying to enjoy this dinner. And that causes anxiety, that constant worry of, yeah, I'm at my baseline, but the scales can tip so fast when you have chronic pain. You could lift, reach, stand the wrong way, and this exacerbates your pain. And it's not just for like that 5 minutes, it could be for weeks. So cannabis has definitely resolved my depression. It gives me dopamine, gets in my brain, I feel good. Cannabis is a great anxiolytic, so for all my patients and caregivers that have been prescribed Xanax, they might need Ambien to sleep. This is great anxiolytic. It's, you know, as far as helping you with sleep onset, sleep duration, cannabis is great for. So yeah, any questions? No? Yeah? Yeah, hey everybody. Yeah, we're just talking about how cannabis can help depression when you have chronic pain. Because I've been there. And especially for, and I don't know about my women, you know, I do believe women can take pain way better than guys, you know, hands down. Ladies can take pain more than men. But I am a man, you know, and I have chronic pain. So when, speaking personally, when men have chronic pain, it's very emasculating. I mean, it's emasculating. It affects your endocrine system, you know, it affects your libido. Your testosterone level drops drastically when you're dealing with chronic pain. You know, my adrenal glands, my fight or flight system, you know, when you see a bear or when you see that crazy dude on the MARTA station, you know, you get this that fight or flight. That's your adrenal glands kicking you epinephrine and norepinephrine like, yo, you need to haul ass, right? My body is in constant fight or flight. It's in constant turmoil. It's in constant, I can't cool my body down because my body's saying, hey man, you're in pain. You need to lay down, but it's on my core. But then again, there's a lot of people with chronic pain. I'm just trying to help you develop empathy from what we're dealing with, because the worst thing about chronic pain and depression is the feeling of isolation and to feel alone. So, again, most people with chronic pain, or 99% are dealing with depression. And what's the worst is you can be in a crowd of people, you can have family, loved one, your spouse, and you are the most you're still gonna feel alone. You're the most loneliest person, and that's what chronic pain can do to you, man. It can get so bad outside of suicide. It causes agoraphobia. You just don't even want to go outside anymore because you just don't want it. It'll deplete you like that. So if you're dealing with depression, we just had Labor Day. That means summer's almost over. And what's after summer? It's winter. Well, y'all gonna say fall, but in my world, especially from dealing with depression and fighting depression, after summer is winter. Now, the sun gives us vitamin D. That's why I always tell you guys, get outside. The sun gives you vitamin D. That helps you make dopamine, So when we get less sun in the wintertime, have you heard of winter blues? Yeah, that's real because we're not getting vitamin D from the sun. Yeah, you don't feel as good. Now, if you already have depression and when you have winter blues on top of that, that could be catastrophic. Yeah, you could be eating a bullet, So you just might not want to be here. Just have complete failure to thrive and feel helpless and hopeless, and you might kill yourself. So definitely, if you think you're struggling with depression from your chronic pain, holler at me. Definitely holler at me. Yeah.
So, Stony Bear, hey Stony.
What's up, Stony?
Light therapy with the brain has.
Yeah, light therapy is great, but nothing can replicate the natural ecosystem. Nothing replicates the sun, Try all these light therapies and salt lamps, but I don't know, I think it's the money. Nothing replicates the sun. Get outside and the sun will hit you and your body will automatically start making dopamine. It makes vitamin D. You need to have it.
Okay, Can Medicine, thank you. She says you need to know how much you're helping just by telling the story, being able to empathize. Very different from sympathy.
Oh, yeah, definitely. Sympathy is something that, there's some jerks out there that just like unsympathetic. I don't know what's wrong with y'all, man. But empathy, unfortunately, is learned by surviving something tragic or witnessing something tragic. I wasn't always just empathetic. Can Medicine. Yeah, sis. I was a good person, great person. I believe I'm a stand-up person. I'm flawed, like everyone that's listening. We're all flawed. But I had a good heart, but I never knew what chronic pain was. I never knew what it was to take opioids day in, day out. I never knew what it was to take benzos and Ambien and have insomnia. I never knew what it felt like not to get up out of bed when, I never felt that alone in my life, So when you come out of that, I don't want anyone to ever feel a second what I felt. So that's the reason why I go so hard. That's the reason why I want y'all to get this cannabis. And that's the reason why I'm doing this little class and being so transparent,
Sharon Everett wants to know, do one-to-one patches work for your health?
Yeah, one-to-one is great for today. One-to-one I like in the morning, And one-to-one, again, CBD to THC. Definitely understand your ratios. When we go into these dispensaries for my patients and caregivers, every product that you buy is going to have a ratio, and you got to understand what ratio works for you. And the best way is to try them all. But to answer your question, 50% CBD and 50% THC, which is a 1-to-1 ratio, is awesome for me from morning to the day. But by the evening, I need more THC. I need about 1 to 3. So definitely understand your ratios.
Vegan Sweet Shoe wants to know this.
This is just CBD too. Sorry to interrupt your question. That's CBD. Again, CBD is non-psychoactive. This is less than 0.3 THC. But CBD is still good for mood, depression. It's good. It's a great mood booster. It's awesome anti-inflammatory properties in this. It's 20 times stronger than aspirin and Motrin, 2 times stronger than steroids. But back to your question, I'm sorry.
Endometriosis pain.
Yeah, endometriosis causes chronic pain. It's a lot of benign tumors that grow from the uterus to the cervix. It can even get into your abdominal wall, and it causes extreme pain. And when you get surgery and laser, what happens? Scar tissue, and then you have chronic pain again. Now you have a different issue. You have endometriosis, and most of it's been cut, burned away, but now you got the scar tissue. And when that nerve starts growing back, you're gonna have chronic pain. Yeah, cannabis can reduce that benign tumor growth, and it's definitely going to help with your pain. It's going to be better than that Motrin, Tylenol, and if you're taking any opioids for it, it's way better. 0 deaths with this with cannabis.
Trust No One wants to know, how did you break your neck?
I broke my neck, man. Playing basketball, being stupid. When your teammate's supposed to call out a pick. Well, I never heard pick. Okay. Your teammate's supposed to say, "Hey, pick!" And I never heard it. So I ran to a guy's chest with my head down, and I ended up busting my C4 and 5. Yeah. Broke my neck playing basketball. In a church league, too. All bad.
Scratch Therapy says 1 flower works great for chronic pain.
Yeah, I like a little more THC for chronic pain. Because I have nerve pain with terrible peripheral neuropathy. My extremities feel like there's glass in my fingertips at all times. After about 4 or 5 hours, this 7 pounds, your head is about 7 to 8 pounds. I'm like this by the afternoon because my muscles have been filleted in the back of my neck. It's hard to hold my head up. So that's why I do telemedicine too, so y'all can holler at me and my head is back. I don't stop working. I just kind of work around it. But
Justine wants to know what about fibroid pain or after an abdominal hysterectomy.
Fibroid pain is real. And just so we know what chronic pain is, this chronic pain is acute pain that just happened that lasts more than 6 months. Again, chronic pain is acute pain that lasts more than 6 months. So in the state of Georgia, if you have chronic pain, it could be from Lyme disease, it could be from a tiny tick bite that caused Lyme disease, and now you have this terrible arthritis in your legs and your knees and your hands. It could be from uncontrolled diabetes, and you're taking all this gabapentin and Neurontin. It's not working, it's not working. And you have these burning and tingling down your feet, and your feet are always burning. That causes chronic pain, and it's lasting more than 6 months. Of course, fibroids cause terrible pain. Even women, as females have their menstrual cycle, that causes terrible pain, which they're taking Motrin for, and Motrin is very unhealthy. So yeah, that's chronic pain. It can happen. Next question. I got lost. But y'all, I really appreciate y'all rocking with me, man. I'm just letting y'all know, hey, I am doing so much better, and everyone deserves to feel this damn good, because I feel great now, despite my nerve pain, but I feel great. And everyone deserves to feel this good at least once, I think every day until you die. But cannabis is medicine that you can use every day until you die. We even have hospice on our list. So I can make recommendations for your first breath until your last breath. And I use it in the life a few times. I use cannabis, suppositories. So even when you can't control your airway, you could be in a coma. You could be traked, and we can use your rectum, and you're gonna get the cannabis. Okay.
So I'm gonna try to pronounce this. Black Ave, Lil Denon.
Yeah. What's up, brethren?
As for a person like him who smokes the regular joint way, how will I know what my dosage or my max dosage is doing it your way?
Well, you gotta if you that's tough because what's out here on the street, and if it's not like super regulated, that's why we do need dispensaries, big bro, because we need regulation. Because if you're buying cannabis that's trying to help you and it's got heavy metals, RPGs, you don't know the grower, it's kind of hard to tell you because, I might say I have Girl Scout cookies and you're going to buy it. And then you go on the other side of town and I'm going to give you some Girl Scout cookies and you're going to have totally different effects, So you got to be careful what you buy out there if you're just buying out there. But in a dispensary, it's going to come with ratios of the CBD, the THC, the CBN, the CBG, the different cannabinoids. It's going to tell when it was grown. It's going to show the grower. So it's definitely more reliable to figure out how it's helping your chronic pain. And, I wouldn't just do smokable. Go to edibles, and try tinctures. Tinctures last way longer for chronic pain. Again, when you inhale to treat chronic pain, you got to inhale around the clock. It's almost every 3 hours, But when you take a tincture or sublingual, or if you ingest it, it can last up to 48 hours, up to 2 days. It sticks to your receptors way longer because THC gets hydroxylized, right?
Spice 701 says, what is better if I have very weak lungs? Lately, she has been on the edibles, but it's so hard to find.
Tinctures would be great for lung health. Vape, if it's a metered vape that give you precision dosing, that'd be great because, what do you have, COPD? Now, if you have like chronic obstructive pulmonary disease, if that's causing your poor lung health, inhalation is a great way because your COPD and asthma is a bronchoconstriction problem. Again, a bronchoconstriction problem and inflammation. It's just two things. Asthma is just your pipes get real tight and it gets clogged up with inflammation. Cannabis is a bronchodilator. It's going to open your lungs up, open up, you get a nice cough, you clear that junk up, and also anti-inflammatory properties. So it's the perfect treatment for lung problems and lung diseases and COPD. Inhalation is great. Tinctures are awesome.
Scratch Therapy says, thank you, I'll try a 1:3 ratio. Everything too funny says, what do you recommend for headaches and toothaches?
Can y'all see me? Headaches and toothaches. If your headache is like migraine or a cluster, what kind of headache you having? There's so many different types of headaches. But if it's a classic, just regular migraine, yeah, cannabis is great for that. It's great. You just got to find a different the ratio and the strands that help you for your pain. But it's great for headaches.
Canna Medicine says tinctures. You can get the THC tinctures in MCT oil.
Yes. Tinctures are awesome. I love tinctures. So again, thanks for tuning in.
Just me says your dog. Canna Medicine truly.
Truly, thank you. Thank you, everybody. And
Cook says make cannabis at home. Yeah.
There you go. That's the next step. That's the next step. We need to do a cooking class too. Yeah.
Black Ave, Lil Dedon, Dadon, whatever. Tell me what it is.
Marley Dedon?
No, it's not what it is. Black Ave, Lil Dedon.
Hey, what are you saying?
Okay. Is my nerve damage considered chronic pain from bullets?
Unfortunately, yeah, you're stuck with chronic pain, boss man. When patients come in with GSWs, gunshot wounds, we look for vital organs that might have been damaged, and we assess that by checking your blood pressure. And that blood pressure is not dropping, that means you're not really leaking, and that bullet stays inside you. But when on the entry and there's no exit, yeah, that bullet has bounced off bones, It shredded tendons and shredded ligaments, and now you got all the scar tissue and nerve pain. Bro, that's chronic. And most doctors will never touch that bullet. 9 out of 10 times you die with those bullets in you.
Teacher Queen says, oh, okay, that's why I take RSO and fill it for 2 days.
Yes, RSO tinctures and edibles can stick to your CB1 and your CB2 receptors for up to almost 48 hours. Again, inhalation is not that. It's only about 3 hours.
J. Quick says he's starting to look into the terpenes and the strain profiles. Everything too funny in migraines. Yeah, you said that.
Yeah, definitely look at the terps, what terps is good for your body. And remember, your nose knows, definitely smell everything that you're about to buy. And if it's good for your nose, 9 out of 10 times it's good for your body. And remember, winter is coming. If you're struggling with depression from your chronic pain, y'all better holler at me. Y'all know how to get in touch with me, okay?
John Osterman, please DM him. Of course, you can get your card. Bless King. Spice 701, please DM him. Thank you, Peter. She says, thank you, our Stone Bear. Cannabis and Magic Butter Maker.
And lastly, if you're on antidepressants and you get your card from myself or another physician, and once you start getting product, I would recommend don't just quit your antidepressants cold turkey. I would taper off, and I would take about 4 weeks to taper off your current dose. So make sure once you get cannabis, don't just stop taking your pharmaceuticals because you'll get a rebound problems, okay? So you want to taper off, and I would safely, to say so, just do it in 4 weeks, just taper off. And if you need any help with tapering off medications, always DM me, and I can help you, okay? And all my patients, if you need any help, caregivers, because most of my patients are dropping at least 12 or 13 in their prescriptions. It's just trash now. So, yeah. But you can't just stop taking your medications. Again, consult a physician, someone that knows what the hell they're doing, and taper you off. Still use your cannabis, just taper off your medications, slowly and safely.
Olivia says she'll be the taste tester for the cooking show.
All right, Olivia. Okay. All right, don't run from me now. Don't run.
All right, I think that's it.
That's it. Any questions about anything else?
Remember you got that giveaway.
Oh yeah, and y'all enjoy the game. It's if y'all watching the NFL, it's supposed to be a good one, man. I think the spread's only 2 points, so it'll be a good ass game. And ATL ho all the time. And we'll do it again next Thursday. So yeah, thanks for tuning in. Smile more you can, and empathy is what we all need, man. Yes.
Sean says CBD shatter. Any good?
It's for me, it's a waste of money. Again, I broke my neck, and I got stuff on my cord. I need full spectrum. THC is a great pain reliever for me, pain mitigator for me. So I need higher THC to help relieve my pain. But it's all right,
Okay, I'm sorry. She says I'm new to the cannabis world. Do you feel the anxiety and take the cannabis?
No, I never got anxiety, but it's real. The only time I've got, that's a lie. I'm capping. That's a lie. Let me see that light. Yeah. I've taken the edible, and I got help. Yeah, I got paranoid like a mug. Yeah, I was shook, man. I never experienced. There's some side effects with cannabis. It lowers your blood pressure. So when you got a guy that's normotensive, your body, when your blood pressure drops, your heart rate might increase. So I had what we call tachycardia. My heart was dumping, right? So I'm like, yo. And so the paranoia really was tachycardia, and it was like I was running, but I was really just chilling. Like I sprinted, like I was sprinting from like bears and police. So my heart was like bumping, right? And then I have never experienced dry mouth that bad. So, and this is crazy. I thought I was so paranoid. I thought if I closed my mouth, I was gonna die. True story. My tongue felt like it was this big, and it felt like there was nothing but sand on it. And I was walking around like this. Yeah, I was scared to put my tongue in my mouth because I thought it was gonna close up my windpipe, and that'd have been the end. And I couldn't like call the ambulance. So I'm like, man, I'm a doctor, I can't call 911. I was in a situation, rock hard place in me. But yeah, one time getting paranoid, I always reminded myself, hey man, no one's ever died from this, and I was cool. So yeah, paranoia is real, but it's really from tachycardia. Just get used to it if you're real sensitive. Yeah, and maybe dry mouth, so you think you can't breathe, but just have some ice water or ice chips at the bedside or where you're at, and remind yourself that no one has ever died. There's in the news that one vape death, so I think that's causing hysteria. There has been one vape death recently tied to a cannabis cart, and they said it was from vitamin E today. So that vape death was associated with vitamin E. Vitamin E seems harmless. You rub it on your skin, you can eat it, but for some reason, it's causing some sickness, some lung issues when you inhale vitamin E. So that means the vapes aren't going anywhere. They're going to fix that pretty soon. A lot of patents are about to be announced. Look what Marlboro's doing. They have their own vape patent that's about to be announced because no one's smoking cigs anymore. So the vape culture is going nowhere. I mean, it's not going anywhere. It's still it's a huge market, and yeah. Sorry, I was rambling for a little bit, but yeah. Cool. Yeah. Oh no, they didn't identify what brand of those carts that was making people sick, but it was a bunch of people in New York, and that death was, I want to say it was Utah. It was Utah, but they tied the death to vitamin E. So it wasn't the cannabis. So all that reefer madness and the sheriff's department, yeah, keep holding your breath. Big alcohol, get out of here. It's vitamin E. It wasn't cannabis that killed that one person.
What about someone who has vision issues?
Man, look what the roster's been doing to treat eye problems. Every ophthalmological problem, did I pronounce that right? But every eye disorder, man, they've been using cannabis. You never heard, give me a hit for my cataracts? Yeah, glaucoma, it's great for, cannabis lowers your intraocular pressure, your IOP, So that prevents glaucoma, and it's great for preventing cataracts, and it's just, it's great. So eye issues, give it a shot. They even use it in the West Indies, fishermen that use cannabis, they're able to do that. They're able to fish at night. Their vision is so dope. They can hit that spliff, and they can fish at night without the radar. Okay? Yeah. And they bleed just like you and me, and it's red. So hell yes, it's great for vision. And FAQ that, man, they really do fish in the dark.
223 CY.
Yeah.
You can get your card here, please DM them.
Yeah.
And, all right.
This is a nectar collector, by the way. You can use your dabs with this.
Everything too funny says I prefer heavy THC indica, but it gives me anxiety now.
Which one?
Heavy THC indica.
Okay, well, definitely try a hybrid or a sativa, or take a weekend off. A weekend off, 1 weekend off a month. I mean, you don't consume any cannabis products 1 weekend off a month, and most of your receptors really reset. Okay, and you'll get those same effects like you did when you first started. Y'all been dope, man. Y'all been great. Keep up the energy and keep being dope to one another. You never know what someone's going through, and you know how much chronic pain and invisible wounds they have. Chronic pain is always usually associated 99.9% of the time. Just to recap, with depression, and he or she feels alone. Okay, I don't care how good they look. I don't care how good the food they cook tastes. No matter, they're still doing their very best just to make it, okay?
No slacky sis.
Oh,
this. I'm scared.
What's what?
Device.
Oh, this is a naked collector. I'm a big fan of trying different products. So this is a CBD dab, and you got to try what's good for your body. You know, there's no one size fits all. So you're gonna do a lot of trial and error. But this is just CBD, and this is a percolator. You heat the nail up. This is a titanium or whatever that is. You heat it up, and you put it right in, and you inhale.
She said, "Look like a trumpet."
yeah, you hear shit. It's cool.
You said some spices. You hitting that hard. I thought good stuff you want have to hit that much, but
it's just CBD. You know, I'm used to full spectrum, so my body's like, bro, where's the good shit? You know, where's the THC? I still have my pain. It's a little uncomfortable, but you know, this is CBD. So don't be scared to try. Ask questions. Make sure it's lab tested, and you're not doing anything wrong. You know, CBD is you can smoke CBD. This is smokable hemp. So if you never smoked CBD or hemp before, check it out. Inhale it. There's so many different types of devices that you can use, but make sure, you know, hand dexterity is very important. People with chronic pain, you know, my hands constantly hurt, so get you devices that ergonomically are good for your hands. This is just one knob, twist, and one button, and it's auto on and turns off. Easy for me. This is a simple pipe with a carb cap. Easy for me, you know. I got a bad neck. This is easy for me. Just heating it up. I don't got to worry about anything. So, you know, for my patients, I'm not talking for anyone that's wrecked. Just get the hell out of here. This is all for my patients and caregivers, okay? Patients and caregiver information only. So the wreck crowd, I love y'all, but you know, y'all don't need to die for me. You know, y'all just do what you do, you know, but y'all don't need to die. All right, and shout out to all my sickle cell warriors in September. I got to do something special for my sickle cell warriors out there. If you don't know anything about sickle cell, they are the strongest people that the Most High have ever created. They deal with chronic pain at as early as 3 months of age. They're taking opioids at 3 months of age. That's their first crisis. Their life expectancy is 40. They're having strokes in their teenage years, heart attacks in their teenage years. They lose organs, spleens, livers. It's terrible. So get to know someone that has sickle cell and just be dope, okay?
Lisa says, thank you so much. She's a mother of a 22-month-old warrior. So thank you for
no problem. Yeah, and what's worse, the worst thing about sickle cell is the caregivers. Caregivers, when you have a sick kid, they go through it the worst because they would trade places with their baby in a heartbeat, and they can't. And they're gonna pray that this will stop. This is the last time, and it's gonna keep on happening. More attacks, and all my caregiver breakdown is real. You know, when you're dealing with someone that's dealing with a chronic illness or terminal illness, caregivers take the brunt of most of those emotions. You know, hurt people do hurt people, and it's usually people that are close to them. It's usually mom, it's dad, it's your spouse. So make sure you charge it to their head, not their heart. They're going through it, but you're the closest thing to them, and usually you catch the brunt of that. So charge it to their head, not their heart. Don't slap them. Just try to be patient, okay? Practice patience. For all my caregivers, patience, and continue to be strong, but y'all need a break. Y'all need a break. Take breaks as much as you can, okay? Your life matters too. What's the free thing? Oh yeah. I got some. What do I want to give away? Yeah, come up. If you, how many pianos did I pass today? Whoever DMs me with, or shout it out. How many pianos I passed today? I got on my story. I got a gift for you. If you got kids, it's probably like an Xbox Madden. Well, if you're an adult that plays, I play too. I got a controller for Xbox. And if you're patient, yeah, man. Yeah.
Well, you said, Denali will be giving you a lot of love, and Sarah says too. But Jusej _Denali was the first one to say two.
It's 2 is incorrect.
It was not 2.
No deuce.
Everything.
Whoever said 2, deuces.
Everything too funny says